Welcome to my YouTube channel. Our today's topic for discussion is antipsychotic medications. In today's discussion, we will learn types, adverse effects, drug monitoring, drug interaction, warnings, and dementia. Types: first generation. 1. Phenothiazine drugs include Chlorpromazine, Prochlorperazine, Pimozide, and Sulpiride. 2. Butyrofenons include benpredol and haloperidol. 3. Thioxanthines include flupentixol and zuclopenthixol. First-generation antipsychotics are more likely to cause acute extrapyramidal symptoms and hyperprolactinemia. Second-generation antipsychotics include amisulpride, ripiprazole, clozapine, olanzapine, risperidone, quetiapine. Second-generation antipsychotics have increased risk of weight gain and glucose intolerance. Adverse effects of antipsychotics: 1. Extrapyramidal symptoms. 2. Hypotension. 3. Prolongation of QT interval. 4. Weight gain. 5. Reduced seizure threshold. 6. Impaired glucose tolerance. 7. Hyperprolactinemia. You can also memorize adverse effects by the sentence excitable honorable. Psychotics will raise glucose happily. Extrapyramidal symptoms: 1. More likely with first generation than second generation. 2. Largely dose-related hyperprolactinemia. 1. Rare with aripiprazole, clozapine, and quetiapine. 2. First generation and risperidone more likely. Hypotension. Clozapine and quetiapine are most likely to cause postural hypotension. Neuroleptic malignant syndrome. 1. Rare but potentially fatal. 2. Signs and symptoms include hyperthermia, muscle rigidity, tachycardia, and sweating. Patient monitoring using antipsychotics. 1. Body weight weekly for 6 weeks, then annually. 2. Glucose test start monitoring at 12 weeks, then annually. 3. Urea and electrolytes test at start, then annually. 4. Blood pressure monitoring at start at 12th week and then annually. 5. Blood count test at start and then annually. 6. Liver functioning test at start and then annually. 7. Prolactin test at start after 6 months, then annually. Note for prolactin test: prolactin not required for ripiprazole, clozapine, quetiapine, or olanzapine less than 20 mg daily. 8. Electrocardiography test at start and after dose change. Drug interactions: 1. Smoking with olanzapine and clozapine. Smoking induces the metabolism of these drugs. Stopping smoking may cause increased adverse effects. 2. Grapefruit with Pimozide. It may increase levels of Pimozide, leading to potentially fatal arrhythmias. 3. Carbamazepine with clozapine, haloperidol, risperidone. It may reduce the plasma levels of these drugs by half. 4. Selective serotonin reuptake inhibitors. Haloperidol is contraindicated with fluoxetine. Risperidone is contraindicated with fluoxetine. Clozapine and olanzapine are contraindicated with fluoxetine. Paroxetine and sertraline, because SSRI drugs may increase the levels of antipsychotics. 5. Itraconazole is contraindicated with aripiprazole and haloperidol, because levels of these antipsychotics may be increased. Warnings for use of antipsychotics: 1. Haloperidol elderly patients are at increased risk of neurological and cardiac effects. 2. Blood monitoring. Monitoring blood concentrations may be required for amisulpride, ripiprazole, clozapine, olanzapine, quetiapine, and risperidone. 3. Clozapine monitoring advised if patient stops smoking, switches to e-cigarettes, concomitant medications interacting and increasing levels, pneumonia, or other serious infections. Toxicity is suspected. Dementia. It may be considered in people with dementia if severely agitated or distressed. Only be initiated under specialist supervision. The only two licensed antipsychotics for non-cognitive symptoms of dementia are haloperidol and risperidone. Haloperidol max dose is 5 mg to times a day. Risperidone max dose is 1 mg to times a day. Treatment should be reassessed after 6 weeks. Risperidone should not be used for more than 6 weeks.
Thanks for your time and support. Stay connected with me to learn more interesting pharmacological studies. Must ask any question or confusion in comment box. Let me know which medicine information you want next. Thank you.